Hello students, today's lecture topic is how to write in exams. There was a lot of requests from students that please discuss how to write in exams. So I am making this video. Exam time is the final match. See, however talented and intelligent you are, but during the examination, when you are in the exam hall, the scenario changes. There are a lot of students who will be experiencing a cold feet, nervousness. Anxiety comes to play a crucial role, and now it becomes very tough to produce an effective answer. See, anxiety is merely the fear of unknown. मुझे याद आएगा क्या जो मैंने पढ़ा है या मैं भूल जाऊंगी सब माइंड में मिस हो गया है all sorts of confusion. But once you settle down, all will be okay. So, before you get the question paper, you should always close your eyes, take a deep breath, relax, and pray. Fill in the students' detailed information. Don't hurry and make mistakes in writing your details. Check the answer sheet provided to you and sign it. If you get a buffer sheet, then you have to fill in the details. So do it carefully. Read the instructions carefully. This is very important. Whatever instructions are written, you should read them carefully and later on you should start writing your paper. See how many questions that you have to answer. At times they are written that out of 6 attempts only 4 answers. So you should read them properly. Don't do mistakes while reading it. Real and real life. There is a lot of difference between real and real life. In real life, there are chances of retakes. But in real life, you don't have any chance of retake. The moment you lose it, it will be forever. So give justice to every movement. In cases of MCQs, once you tick an answer, now you can't change it. So read the question properly and then select your answer. Don't make hurry in selecting any options. You have ample time if you use it wisely. So you should use your time wisely. Read questions properly and carefully. See what the examiner wants. You should know what to write. Read the question and see what the examiner wants from you. I have checked many papers in which, in panic or in hurry, students they don't read the question properly and they write something else. For example, like mastitis is asked and they are writing mastoiditis, and that's just because of hurry and panic. ऐसा नहीं है कि स्टूडेंट को आता नहीं है, पर वो उसको दिखता ही वो है कि या मेस्टाइटिस लिखा है या मेस्टोइडाइटिस लिखा है, जल्दी जल्दी में वो उसको अटेम्प्ट कर लेता है. और अगर पूछा मेस्टाइटिस है और मेस्टोइडाइटिस अगर आप लिख रहे हो तो क्या होगा, आपको 0 मिले. यू विल वेस्ट योर टाइम एंड यू विल नॉट गेट मार्क्स. Don't just start writing. Many students are in a habit that as soon as they get the question paper, they start writing down. No. First read the paper thoroughly. Plan writing according to the question asked. How many marks the question carries is very important. Don't just go on writing. If question is asked for 2 marks, 4 or 6 points are sufficient. Many times students ask me, ma'am, what should be the length of the short note? But I will tell you, we don't give marks on length, but it's the content which will earn marks for you. Time management, that is very important and crucial. It plays a very crucial role while you are writing your papers. Before you start writing, make a schedule. Think about how much time you have, and from that time, how much time you should spend on your each answer. So time management is very important. And if you are short of time, then even if you know the answer properly, you can't complete your answer. And so your time, and so use your time wisely. Don't leave any question unattempted. That is very important. If you are not attempting the question, then you will not get marks. Don't leave multiple questions for the last time. Many students are in a habit that they leave many questions for the last moment कि अभी नहीं आ रहा है मुझे, मैं ये भी बाद में लिखूंगा, वो भी बाद में लिखूंगा. तो लास्ट मोमेंट पे करता है आपके पास टाइम कम बचता है और फिर आप पैनिक हो जाते. तो इसीलिए आप लाइन से चलो, सीक्वेंशियली चलो और लास्ट मोमेंट के लिए कुछ मत चुनो. डोंट लीव द एग्जाम हॉल अर्ली. स्टूडेंट्स को हैबिट रहती है कि पेपर हो गया है मेरा लिखना और मेरे को बाहर जाना है, पर ऐसा नहीं करना चाहिए. आपने वहां बैठना चाहिए, पूरा पेपर रीचेक करो वेदर यू हैव अटेम्प्टेड ऑल द क्वेश्चंस और नॉट, कुछ क्वेश्चंस छूटे हैं क्या. और अगर आपके पास टाइम है तो देन यू कैन राइट डाउन दैट क्वेश्चन properly. Always recheck what you have written. If you are having time, then recheck what you have written. And if you want to add something or if you want to cut something which you are thinking is wrong, you can do that. How to write answers. Writing answers in medical exam is an art. Because of huge content, lot of material is available to read. But time is restricted for paper writing, and also the evaluator cannot read your answer word by word or line by line. So it's up to you that we write your answers in such a way that it becomes easy for the evaluator to go through your answer sheets and give you marks. And that's why presentation is the most important. More presentable your paper is, more marks you will get. Your handwriting should be neat and legible. Medical fraternity is always defamed of people with poorest handwriting in the society. So try to write neatly so that examiner should be able to read what is written. They don't say that there are extra marks for good handwriting, but at the end it counts. You will always get few extra marks overall at the end because of good handwriting. Many students ask whether we should draw margins or not. But actually, in university exam, when you get your answer sheet, the margins are already drawn on it. So there is no need to draw margin, because if you are drawing extra margin, you will waste your paper and at the end, you will not get extra supplements. Because in university examination, you are getting a bunch of answer sheet and you don't get extra supplements. Write correct question numbers. That is very important. In hurry, students forget to write question number. But you should write down the question number properly with the sub question number, like question number 2A or 2B, 2C. So you should write down correct question number and then write your answer. Avoid jumping from one question to another question. You should attempt your paper in a sequence. For example, if question number 3A you are attempting, after that you go to question number 4A or question number 6, then you again jump to question number 3B. So don't do this type of jumbling when you are writing your paper, because it becomes difficult for the examiner to evaluate your paper And at times you also forget that, yeah, I have attempted one question or two question from this answer and then I left another question. So it's better that you should follow a sequence. But at times, if you are not able to follow the sequence, once or twice it's okay. But always you should not jump from one bigger question to another question or sub question. Always write headings. Like if question is asked rule of 9, question 2a, rule of 9. So you write down question 2a, then you write rule of 9, and then you should always underline it so that it becomes easier for the examiner to evaluate your paper. Answer in points. That is very important, that whenever you are writing an answer, you should write down in relevant points. Don't write answers in long paragraphs or like a story writing. Remember, quality is always preferred over quantity. So your answer should be point specific and there should not be repetitive sentences in your answers, and it should not be vague. It should be relevant to the question asked. In medical, diagrams are very important. So whenever you are writing any answer and if it is possible for you to draw diagrams, you should draw diagrams wherever possible. They should be well labeled. Each diagram should be well labeled. So you'll get good marks at the end. At times, even if you are having a lesser time and you're not able to describe the answer in detail, in that place you can draw the diagrams. They should be neat and tidy and they should be labeled. Diagrams without label doesn't carry marks. Flow charts and tables. Wherever possible, you can draw flow charts or tables. See, I have given here one example in which I have shown that you can draw flowcharts in this pattern. Just you write down the main headings that should be followed by arrows like type 1 diabetes mellitus. So in this way, I have explained that you can draw flowcharts or tables. This will save your time and it becomes, your paper becomes very effective and you get good marks. Whenever you are writing differences, at times differences is asked that show the difference between this or that, or for example, if it is difference between direct hernia and indirect inguinal hernia, so you can make a column and you can write down the points. While writing differences, you can also give some examples also in difference. You can use a fresh paper while writing a new question. Like whenever you are writing question, you finish question 1, B or C question, and then you have to write down question number 2A. So always use a fresh paper. Leave space between first and second answer, because at times there is a confusion that where your first answer ended and when you started the second answer, because you're not writing the number, you are not leaving any space. And when the topics are interrelated, then it becomes quite difficult for the examiner that when your first answer ended and when you started your second answer. Leave proper space in between the answers. Avoid roundabout. That is very important. Avoid unnecessary lengthening of the answer. आप आंसर को गोल 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 घुमाकर अगर लिख रहे हो तो एग्जामिनर को समझ में आ जाता है कि ये स्टूडेंट को कुछ आता नहीं है, लेकिन 2 या 3 लाइन आती है और उसी को वो घुमा घुमा के बस लिखना है और आंसर बड़ा कर रहा है. आई विल गिव यू जस्ट वन एग्जांपल, like hepatitis. If hepatitis is asked, students write it is the most common disease. This is the first point. Second point is many students suffer from this disease. Third point, it is a disease which affects a large number of population. Next point is many people fall prey to this disease. It comes first in the list of infectious disease. So all this is nothing. So you'll not get any marks. You have written 5 points, but they don't carry any weightage. You have to write down about hepatitis. We know that this is a common disease and that's why only we are asking in exam. So don't go and writing rubbish and roundabouts. Just going on writing something is not going to give you any marks. Don't write rubbish. As I told you कि लिखना है इसलिए कुछ भी लिख रहे हैं, all sorts of rubbish, वो नहीं होना चाहिए. Wherever possible, write clinical aspect and applied anatomy. That is very important. In case of anatomy, physiology, biochemistry, you can draw diagrams as you told you previously, or you can write down cycles in biochemistry. Attempt all questions. Don't leave any question unattempted. If you know something about that question, try to write down few points related to that question. I'm telling you, don't write rubbish, but related to that question, you can write down. Last but not the least, use a good pen. While writing, if you're using a good pen, your handwriting will be neat and your paper will look neat and tidy. I tell you, you don't use ink pen. The reason behind this is many students they suffer from anxiety and they sweat a lot. So if there is a lot of sweat on their palm and when they touch the paper, all the ink gets blotted and that will make your answer look very bad, and at times examiner will not be able to read your answer also and you will get 0 marks. Secondly, at times if water falls on your paper while you are drinking during exam, so that will also spoil your answer sheet. So these are the few points which I have discussed with you, how to write in exams. If you are having any queries, you can put a comment